Hi, my name is Tristan. It's March 8th, 2018, about 12:40ish in the afternoon. And I'm going to show how to put a catheter in a female patient today. So the first thing that I would do is assess my patient for why they need the catheter, if they have any allergies to betadine, which is sometimes used with putting in catheters, the size of the catheter, and I want to know when they last voided. The second thing I'm going to do is I'm going to go in, introduce myself, provide privacy for the patient by shutting the door or closing the curtain. I'm going to check their ID band for the two patient identifiers, name and date of birth, compared to what they say and what my MAR says. I'm going to explain the procedure, and of course I've introduced myself. So the first thing I'm going to do is I'm going to wash my hands, and I'm going to have the assist the patient in getting into the supine position with their knees flexed to where we can get started with the catheter. So I'll get my patient in kind of a frog-like position, like that, and then I'll give them a bath blanket for some extra comfort or privacy if they would prefer. And then I'm gonna wash my hands, put on some just clean gloves, and we're gonna do some pericare. Pericare is essential before you put in the catheter to just kind of prevent infection or get any bacteria off. So you can use like some wipes, or you can use some pericare solution on like a washcloth. In this case, I'm just gonna use a wipe. So I'll get my wipe out. And I'll just do front to back pericare, just cleaning the area, getting it nice and clean and ready in between the labia. And then throw that away. Take my gloves off because they're now dirty. And wash my hands. So now that the patient's ready to go and the pericare is completed, I'm gonna make sure that I have all my equipment gathered, which I would have done before I came in the room. I have my Foley kit right here, so I'm going to make sure that it's the right French, it's not expired, and all my supplies are good to go in there. So for this procedure, I'll use this lubricant. For our mannequins, they need a little bit of extra, and we can't use like actual jelly lubricant. So when I open up my kit, I'm going to start by opening it away from me. And I have a 1-inch border tube that I can touch on the outside of this that's non-sterile. And then I have my gloves on top, so I'll take those out and just set them aside for a second. These are my sterile gloves. Then I have a drape right here that I'm going to place under the patient to make it a sterile area. Just touching the 1-inch border. Okay, and that's a sterile area for my patient now. So what I want to do next is put on my sterile gloves. Being careful just to touch the edges of the gloves that are non-sterile. Go ahead and put these on. Okay, so now I am sterile. So I'm gonna go back to my kit. I'm gonna open up my swabs and go ahead and get them out and ready. I'm going to hook up my syringe of 10 cc's to my catheter and just check and make sure that the balloon inflates. And it does. So we are good to go. We have a good working catheter. And some places and hospitals don't want you to test that, so just follow your hospital protocol on that. So what I'm gonna do now is I'm gonna take one swab first, and it has a solution on it. I'm going to take my non-dominant hand and go ahead and spread the labia. And now my non-dominant hand is not sterile. But this one is, so I'm gonna swipe on the farthest labia away from me, front to back. One swipe down. And then same thing, the other side. And then last one, I'm just gonna go straight down the middle, down the meatus. So now, what I can do, since this is sterile and this is a sterile field, I can go ahead and lubricate my catheter without breaking sterility. Take this, put it in my sterile field. I'm going to ask the patient to bear down like they're going to void and just take a deep breath. I'll enter the catheter until I see urine flow into the catheter. Then I'll go about 2 more inches, and then I'll blow up my balloon. And then I'll just kind of tug on it and make sure that the balloon is sitting on the edge of the bladder. So now that that's done, I'm going to take off my sterile gloves. Wash my hands. Put on a pair of clean gloves, which I would have out and not here in the trash can. They would already be out and ready. And then I would take my catheter and I would attach it to the leg, and then make sure that the catheter is over the leg. This is off since the balloon's blown up, and it's attached to the leg, and the catheter is on a non-movable part of the bed and draining urine. That's all.